Okay, can everybody hear me? Okay. Well, I'm Jennifer Little from Klamath County Public Health, and I'm new to my role. I just started in November, but I actually worked for public health prior to that. So I wanted to just give you a quick overview of the county that I live and work in. Klamath County is in the south central part of Oregon. We're about 20 miles from the California border. And we're on the dry side of the state, so we're not anything near or like Portland. And our county is the size of Connecticut, but we only have about 66,000 residents in the whole county. So we're rural, which is why I asked my question earlier. And we were historically a logging community, and the logging industry has really died out there, and so we have a lot of poverty in that area and a lack of living wage jobs that we're trying to reinvent ourselves through recreation and renewable energy, those kinds of things. And just to give you a quick idea of what our population looks like, we're about 78% white, 12% Hispanic, 4% Native American, 4% mixed race. And nearly 1 in 5 people are living in poverty. I think it was maybe Benjamin who said South Carolina? North Carolina. North Carolina was very similar to that. And we are a HRSA designated health professional shortage area. So our HPSA score, if you've heard of that, is high. And one of our big struggles is simply retaining health professionals. And so because our lack of availability of clinical care has really shifted the importance to, we need to be preventing sickness and chronic disease and illness and reserve that care for those who are truly sick. And so we don't have much, but we've done a lot with a little with our resources, and partnership has been really huge for us. And so we've really done a lot with our community health programs, and we've tried to align our resources in ways to really maximize the dollars or the people who are doing the work. And the county health rankings, so starting kind of the beginning of our journey was back in 2012. This was our second year of the county health rankings, and once again, we were at the very bottom for our state. And since then, we've continued to be at or near the bottom. And some of the major healthcare players said, this is a call to action. We can do better than this. And so we created the Core 4, as we call it. So it was public health, our hospital system, Sky Lakes, our FQHC, Klamath Open Door, and our CCO, which is our local Medicaid provider, Cascade Health Alliance. So we all came together and we said, what are we going to do about this, and how are we going to do it? And so we created one joint community health assessment and one community health improvement plan, which that was step one. At least we're all driving in the same direction. And because that was our first time, we were spread way too thin. We were very broad, and although we had some successes, it wasn't the best. And so through each iteration, we've gotten more focused, we've brought in more community partners, and so we formed the Healthy Klamath Coalition. And it has cross-sector representation from law enforcement, schools, local elected officials, of course the healthcare industries, the social services, all these different players have come to the table. And we've worked really across several different initiatives. And then in 2018, we became a Robert Wood Johnson Culture of Health Prize winner. And yeah, it was really exciting for us because yes, we're still at the bottom of the health rankings, but that's not the most important thing. The most important thing is we're working towards better health outcomes for all of our people. And so I just really quickly want to touch on a few of the initiatives that we've been working on. And I've got 6 minutes to do it, so I'll be quick and then people can ask questions. One of our big accomplishments has been in our food systems work. And I don't know if anybody's heard of something called Blue Zones Project, but it's a health improvement framework that really focuses on your life radius within 5 miles of where you live is really where you spend most of your time. So how can we improve the food systems there? And we're an agricultural community. And so we wanted to make sure that we have access to the products that are being produced in our community. We want those to stay local, and we want everybody to have access to them. So the food bank created the Produce Connection, where they started out, they wanted to move, I think it was 60,000 pounds of fresh produce throughout the community. No questions asked, no eligibility requirements. It's just there at these different sites. So that was several years ago. It was a big success. The next year, they moved 600,000 pounds of fresh produce. 2018, they moved 1 million pounds of fresh produce throughout our community at multiple different sites. They were at clinics, they were at the WIC office, they were at near the Mission, where our job training program is, they were in the parks. Really cool initiative. So that was really step one. And then that led to, from the Blue Zones project, they had a food systems committee, and they created the Klamath Farmers Online Marketplace, KFARM. And that's kind of like, well, it's an online market, an online farmers market. So we've got these producers, ranchers, the farmers, honey, beekeepers, those kinds of people. And each week they post what they have available, and then individuals, maybe like myself or somebody who's lower income, they can use their SNAP benefits, and they click, oh, I want this bag of lettuce, and I want this dozen of eggs, and I want this piece of meat. And then they go and they pick it up every week. And so it's year-round. So that program has been really successful, and they're trying to grow it right now. And they only have, I think, 12 SNAP members who are utilizing that service right now. So we're hoping to grow that and make it more accessible. So the food system, that's been really big for us. And actually my colleague Jesse and I were just trying to solve some of our community problems over lunch, and how can we bring more fresh foods, healthy foods to the inmates and the kids in juvie and those kinds of things. In addition, we have Klamath Promise, which that initiative is working on high school graduation. We had really poor rates of graduation in our community, and we found that a lot of it was chronic absenteeism. And some of that was from health problems. Kids aren't going to class because their teeth hurt. They haven't been to a dentist, or they're not going to class because they're sick and mom and dad can't get off work to take them to the doctor. And so that initiative has been really great because they're working on eliminating, or at least reducing, the barriers to going to school. And then we're trying to help them graduate, or at least earn a GED, so that they can be healthy throughout their lifespan. We know the importance of education on health outcomes. So that's been really great. And then a couple of other quick initiatives in my last 3 minutes. We have done a lot around tobacco policy, and I won't spend a ton of time because it sounds like you'll talk a lot about that. But we've really worked on not only providing tobacco cessation resources within the community, because that was really limited just 6 years ago. And so we're not only expanding that, but then we're looking at how can we prevent kids typically from starting tobacco in the first place. So we've been working a lot on tobacco-free places. So we're working on tobacco-free government properties, tobacco-free fair, tobacco-free parks. We're working on tobacco-free downtown. We've gotten a lot of pushback on that. But we were also a really big one. We were able to get tobacco retail licensing throughout the whole county. And so now we are able to regulate these retailers and making sure that they're not selling tobacco to youth, because about 1 in 3 tobacco retailers were selling to youth. And so we're working on increasing enforcement and education with our retailers in that vein. In addition, we are spending a lot of time on our built environment and trying to create places for people instead of places for cars. And so we have been able to pass complete streets policies and looking at connectivity, and our mayor just signed on to the 10-minute walk campaign, where the goal is to ensure that everyone, regardless of your neighborhood, are within a 10-minute walk to a park. And we want you to feel safe in those parks. And so our law enforcement has been really great in partnering with us, and we've had really big success in working with our hospital and our CCO, which is the Medicaid provider. And they've invested tens of thousands of dollars into our parks to make them places where people actually want to be, make sure that they look pretty and that people are utilizing them, because that inherently gets people outside, which is good for your mental health, it's good for your physical health. It increases property values, it increases feelings of safety and community connectivity. So those are some of the big things that we're working on. And finally, I'll talk a little bit about a really great partnership between public health and the health system. Oregon Health Science University has created a hub in Klamath Falls, and we have a rural campus. And so not only do we have a medical residency program that's wildly successful, we now have clinical students who are coming in and doing rotations in our rural community. So we have PAs, FNPs, dietitians, pharmacists, dental students. All these people are coming through our community, and they're working with public health and social service agencies to do community health projects, so that, one, they can learn that health doesn't just happen in the clinic, it happens outside. And it's hopefully helping them feel like, I can make a big difference in these rural areas. I think I want to practice in these rural areas. We hope it's in Klamath Falls. Sometimes they go to other outlying rural communities, and that's still a win for us. And I'll end there.